People come in and everybody in my family had cancer. So they're just sort of resigned to the fact that that's their future. I try to empower them in that you can take action to prevent that as your future, because it really isn't the genetics, it's the environment, which goes back to the toxins and the food and all of the things that we're putting in our bodies.
Unfortunately, a lot of oncologists are not trained in nutrition. I hope that changes in the future, because I'm hearing this time and time again from patients that their oncologist said diet doesn't matter, eat what you want. We want to make sure that you gain weight. What's your opinion on that?
Every time I took care of a patient with breast cancer, I did even more research, because my goal for that patient with breast cancer was to help figure out the why did they get cancer, and then complement their care, boosting their immune system, helping reduce sugars in their diet, helping them be on an anti-inflammatory diet while going through therapy like chemotherapy or radiation, and really helping boost their immune system so they handle the therapy better. But in the meantime, in the back of my mind, it was, okay, well, how am I going to learn from these patients to help prevent people in the future? Because that's what we want to do, is prevent these diseases.
Welcome to Rethink My Health podcast and radio show, where each week we come to you from our studios in Atlanta, Georgia, talking about chronic disease, healthcare matters that matter most to you, your family, your loved ones, your friends. And as I say time and time again, they do really matter to us, the research scientists, the practitioners, the physicians in the trenches, day in, day out, talking about chronic disease. I like to use the term advanced chronic disease. We're experiencing an all-time high right now in the United States of advanced chronic diseases. Millions and millions of Americans are suffering, and we need to get real answers. We've been going through a series right now for the past 4.5 months, talking about cancer, talking about chronic diseases such as diabetes, obesity, autoimmune diseases. And now I want to switch gears a little bit. I want to really focus on what drives healthcare. In my career for the past 3 decades, I realized at the very, very early onset that women drive healthcare. Women are the innovators. Women are the caregivers. Women actually are in tune with their body as opposed to men. No disrespect, men, because I am one. You're usually in denial. And men kind of just wait until their arm falls off. There's nothing wrong with me. I'm seeing a little bit of a shift, which is a positive thing, but that's still driven by women. I'm going to introduce an expert in a minute, someone who has devoted her entire medical career to root cause, to wellness and prevention. But I just kind of want to lay the foundation here, because we've had some really exciting news in recently in healthcare from the Women's Health Initiative. There's been a lot of misinformation on hormones, that hormones are dangerous and that they can cause potentially cancer. And finally, the data has come out that all of that information that came out from that think tank 20 something years ago was false, because used appropriately, and I use the word appropriately, exogenous hormones, when women hit menopause, there's a plethora of symptoms out there that they would benefit from using hormones. Now, functional integrative doctors take it one step further, and we talk about root causes, and we talk about getting the body ready for the hormones, and we like to use bioidentical hormones. But even so, that's really exciting news. So let me just jump right in right now and introduce my guest. She's actually a friend and colleague I've known for many, many years, Dr. Kristine Blanche, who was recently appointed to the council with the NIH and talking about wellness and prevention. Kristine, first of all, welcome to the Rethink My Health podcast. Let's talk first a little bit about you, because I know you focus a lot on wellness and prevention, and we're going to talk a little bit about thermography, breast health, and that. Talk a little bit about you. Tell me a little bit about yourself, how you got in medicine, and bring me up to right now to this exciting news that now you're going to be part of this complementary integrative health with the National Institutes of Health. That's exciting.
It's very exciting. Thank you for having me, Gez. I really appreciate it. We've known each other a long time. I always say I took the long and winding road through medicine. I started off in college in EMS. I got the EMS bug. I was an EMT. Then I became a paramedic. Then I worked in the emergency room at GW and trauma as a trauma technologist. I was an adrenaline junkie. I was very good at trauma. I then went on to PA school and worked in surgery for a while, and then up into critical care again, very high intensity, very exciting, life or death kind of stuff. And I absolutely thrived in it. And it really wasn't until my sister-in-law was diagnosed with cancer at 32 years old, Hodgkin's lymphoma. And she just had a beautiful baby girl, my niece. And my intuition was that I needed more than my medicine. I knew the best people to get her to. I knew the best surgeons, the best oncologists. But I went searching and I started reading every book I could get my hands on. And I think most people in our field have either a personal experience with a health crisis or a family member, but I started reading every book I could get my hands on, and I read about nutrition, and I read about toxins, and I read about root cause, and thinking about why does somebody actually get sick, and that was so new to me. That was nothing I'd ever learned, and I would say my mind was a little blown, but unfortunately we lost her very quickly. She died 8 months to the day from diagnosis, and I call that like the dark night of my soul, because I had this new awareness of all these things I hadn't learned about, and they made a lot of sense to me. So I started with myself as patient zero, and I started, because I also had this realization that I was maybe doing everything wrong. I could eat better, and I could control. As a type A New Yorker, I definitely could do better with stress. And so I started yoga.
Most of us feel that way, especially New Yorkers. I totally agree with you.
Absolutely. Yes, absolutely. I mean, we're born and bred to thrive in stress, and that's not good for your health. So that was a new awareness for me. And I started learning this, and I started practicing on myself. And, I ended up going back to go to medical school at 40 and did my PhD research in thermography and breast prevention. I worked in Long Island in my first practices, so there's a lot of breast cancer. And that was sort of my passion coming into integrative medicine, was helping with complementary care for cancer patients to help them understand that food mattered and they could fuel their body and they could do better through treatment if they incorporated some stress relief and things like that. So that's where I really started. And I started my practice in 2008, so it's been a long time. And I have had clinics in New York and I've gone down to Florida now. And I'm just really passionate about, like you said, I work a lot with women. I work with men also, but women bring this information home and they disseminate it. So if you get the information, like I was a young mom sitting in integrative conferences crying because I didn't know any better. I was a mom that was, a conventionally trained medical practitioner doing the best I can with the information I had until I had new information. So that's what I think is so exciting about getting this information out and a national level, getting this, changes in the food and food dye removed and, changes in the farming practices to actually see that we are now changing the foundation of food in our country. As a practitioner, I think is so exciting. It's really, really exciting.
Well, thank you for sharing that. By the way, we live in very exciting times right now because this current administration, with the appointment of RFK, is one of the best things that's happened to functional integrative medicine. And for those first time listeners, this is Rethink My Health. This show is really about education, it's about awareness, and it's not here to replace your medical doctor or your practitioner's advice. It's really to help you take action and to galvanize yourself into any type of situation. As Dr. Kristine Blanche just mentioned, I personally believe that the best doctors and practitioners are the ones that were searching for themselves or a family member, such as yourself. And I'm sorry for your loss. I know it's difficult with the grieving process. I had a very similar story as well with a family member with my dad with cancer, and that kind of inspired me down the road to go into medicine as well. And I realized that a lot of individuals out there are searching and they're looking, and typically the status quo doesn't give them the answers. So let's just jump right in right now and talk about women's health for just a second. Now, with your recent appointment being an advisor at the National Center for Complementary and Integrative Health, I think it's important to really discuss some of the women's needs because, breast cancer is increasing right now. Even though we've got some great diagnostic tools, the standard of care, the gold standard is mammography. And I'm not here to talk about replacing mammography, but I just want to talk a little bit about, let's educate our listeners, Christine, about thermography a little bit. I know that you did a lot of research with thermography. What exactly is breast thermography?
Yeah, it's a great question. So thermography is a camera. It's a camera that takes an infrared picture of your body and it will show me inflammatory patterns. So We know that inflammation is the cause of all things bad, right? From heart disease to cancer to dementia. We know that inflammation is causing havoc in our bodies. So when I take a picture, I do a full body thermography, I can do one body part. I see patterns that tell me where the problems are, right? So it's great before and after experience for patients, because if I do a full body thermography, it's from head to toe, right? I can see sinus inflammation. I can see if there's a hypothyroidism, I get a cold spot over the thyroid. I can see carotid inflammation at 5 or 10% long before we are at risk for something like stroke. I can see the breasts is the right breast more dense than the left breast? How dense are they? I can see patterns of neovascularity, so that's new blood vessels coming to an area to feed potentially bad cells years before that's going to show up on a mammogram. So this is a much more preventative test. It's not a reactive test, which is why it does get a lot of criticism in the conventional field, because we don't think traditionally, we haven't thought about prevention, right? So we don't know what to do with just random cells that might in 10 years become a problem. Whereas for me, as an integrative practitioner, I could change your diet, I can get you on vitamin D, I can make real impact in detoxifying your body and decreasing other reasons for inflammation to hopefully prevent a problem in the future. Even gut health, we can see inflammation. A celiac patient comes in, I see that full body thermography. It's almost tells me exactly what to test for to make sure, because I can see the loops of small bowel pointing at the camera and all of the joint inflammation and all of the havoc that inflammation is causing in a body. And it's incredible. It's pictures worth 1,000 words. Couldn't be a better phrase to describe thermography.
Absolutely. Great explanation. I really like that, because I have to agree with you, because right now we live in a reactive model healthcare system. And certainly we're not, I'm a big believer in diagnostics. I think using CT scans and ultrasounds and mammography when appropriate. There are some new technologies right now with less radiation. The less radiation, I think the better it is. You use it wisely when you need to. But what we're talking about right now, we're talking about a potential screening tool from potentially years and years and years before cancer or any other pathology may develop. And that will give you the ability to educate that patient, is what I'm hearing, correct? So you're basically taking a picture, it's a thermal screen, and you can actually look for hotspots, and you can use that to motivate a patient to take action. Is that what I'm hearing?
Absolutely. And I always say it's more of a test of physiology, whereas your mammogram, your ultrasounds, your MRIs, they're more of a test of anatomy, right? They're going to tell me where the tumor is, how big the tumor is, how the tumor looks, is it irregular, is it smooth? Thermography is how is the body functioning, right? Which is a lot more I think proactive and preventative, which is why I think it's really taken a back street in the forefront of conventional medicine, because we don't treat root cause. We really aren't taught. And I'm hoping now with nutrition coming into medical schools, this is going to shift, the dynamic of prevention in medicine. But, it's really imagine taking a before picture, making dietary changes, detoxifying your body, taking an after picture, the impact that before and after has on a patient. It's such a pat on the back that like all that hard work you did is working. It's so formative. It's so much different than just looking at a blood test and being like, wow, my CRP was high and now it's low. This has such an impact for patients.
Because let's be honest, we're all visual, and I totally agree. At our clinic, we do refer to thermography, but also what we do is we do a lot of scans. We do something called a Staiku scan. We do it in body, because as humans, we're visual, right? So what motivates us is visual. Not to do body shaming. This is not about body shaming. This is about body awareness to take action. And that to me is what's exciting about what you're talking about with thermography and other tools. How do you see thermography in the future fit into a conventional model? Is that even possible?
I mean, I dream of a time where it is in every clinic, conventional or integrative, because I think it is, again, such a great tool for seeing the bigger picture in a patient's risk factors, seeing how much inflammation and the patterns of inflammation, implementing a change, even for the medical practitioners to see a before and after and not you can't acknowledge they've made a difference, right? And it's such a empowering tool for the patient to see the difference. They stick with their lifestyle changes. They stay on their anti-inflammatory diets longer. They just it's so you can't deny it. It's there. It's objective.
It's a powerful tool. I totally agree with you. So let's move on to that then. So basically, when you were working with patients and you were doing a thermography scan, and then you're going on to the next level. So I want to talk a little bit about hormones for a second now, because that's kind of the buzzwords right now. And from a diagnostic perspective, I know that there's a lot of practitioners out there. I'm not trying to criticize, but they just jump to a hormone, and I believe there's a lot of steps in functional medicine that we have to talk about and educate our listeners and our viewers right now, because you just don't jump to a hormone. Okay, there's many things. So let's talk about some of the principles on functional integrative medicine. What type of testing, once you screen a patient for thermography and you know that they have a plethora of symptoms, what kind of blood testing, saliva, gut testing do you actually recommend?
Absolutely. So, we want to get a picture of the whole person, right? So, we do the thermography, we do full blood panels that include hormones, vitamin levels, inflammatory markers, autoimmune markers, because a lot of patients are walking in with signs of, 1 in 3, I think, have signs that they're in the autoimmune risk factors. We look at hormones. I am more of a naturalist in that I think of women's health and just my 20 years of looking at hormones and talking to patients. The history that the patient gives me is the most important part, right? So if I have a 30-year-old come in and she says, I've had my period since I'm 13 and I'm in bed for 3 days and I have cramps and breast tenderness and PMS and, I can't function for 3 days. Immediately, estrogen dominance is the forefront of my concerns for her, right? And unfortunately, young women are coming in. Most have some version of estrogen dominance because there's so many estrogenic chemicals in our environment. We've got plastics and parabens and skincare products, and I also used to lather my children in sunscreen when they were little because again I didn't know any better, right? So exposing our bodies to all of these chemicals in the environment has taken a major toll on our hormones. Same thing is true on the other end of the spectrum. Women come in perimenopause, right? And I would say that the vast majority, I mean, the difference between, the mildest case where they're like, yes, my period got a little irregular and maybe it got warm a few times, to, you know, 40 hot flashes a day, drenching night sweats, want to kill my husband because I'm so anxious and upset and I can't sleep. That is a spectrum that women fall on, and they can last a few years or it can last a decade. Those women that I find when I check their toxic levels, they are the most toxic. So for me, detox is it's a big part of my practice. It's something that I kind of hang my hat on, and that I really believe it is so important. We are surrounded by chemicals, and yes, I'm happy we're aware and we're starting to pull back and we're starting to make changes in the industries where we can find cleaner products, but we all have toxins. We're all walking around with a lot, and it's affecting our hormones primarily, and that's a major thing. So I'll use bioidentical hormones and have for years, but I also kind of think of them like a necessary Band-Aid to ease symptoms while I do the work underneath, healing the gut, getting the body ready for detoxifying. And then the women come out on the other end, their periods are great. I can take a 25-year-old that's had terrible periods her whole life, and within, a few months, she's great. No symptoms at all. I mean, they call me in shock. They're like, well, I don't understand it. I didn't know my period was coming. I'm like, yes, that's good. That's a good thing,
Yeah, success.
So
Absolutely. I agree. And I'm glad you're mentioning this, because this is a big problem in our society. I've done a lot of research myself, and I remember about 2, 3 years ago, I pulled up a couple different studies from the Environmental Protection Agency. At that particular time, it was 2023. I've not looked at the new ones lately. They're about a year or two behind. And we're talking about 4.3 billion pounds of chemicals in the water, in the land, in the air. Now we've just finally researched some data that's coming out in Europe, that microplastics are insidious in the air. And I interviewed Dr. Burdett, and she pulled up couple different studies that the average American now is actually swallowing. This is shocking, by the way, Christine, swallowing the size of a credit card of plastic in the air. No one would even think that these microplastics. So now we got to be concerned about air quality. But I want to stay in tune with what you're talking about for hormones for a second, because if you're listening to our podcast and are watching us on YouTube, Rethink My Health, we're here to educate you about the advancements of women's health care. And one of the reasons why we're talking about this is that these toxins are called endocrine disruptors. And these endocrine disruptors basically will destroy how your body makes hormones at that cellular level, because a lot of patients don't realize, as you and I both know, Christine, we make hormones in the liver. And you go to a practitioner that might have done a weekend course on hormones, and they walk out with their bag of goodies of hormones, and it's like putting jet fuel on fire. Because I love what you just said, we need to prepare the body to accept these hormones. So before you get to the hormones, you got to evaluate the hormones, evaluate the liver, look at the detoxification pathways. And I have a very simple rule of thumb: if you cannot pronounce the chemicals on the ingredients, right? If you can't pronounce it, don't take it. It's horrible. These endocrine disruptors are terrible. So I'm glad your philosophy is about detox, because you're speaking my language there. Okay, so once you do all that, walk me through a little bit about some of the other diagnostics that you use. You mentioned gut health as well.
Yeah, so microbiome testing has come a long way. I think genetic testing is wonderful. A lot of people are afraid of knowing what's going on with their genes. And I always say, listen, genes load the gun and environment pulls the trigger. So if I know that you have, a mutation on your MTHFR gene, which might leave you open and not a good detoxifier, that's empowering me to help you feed those genes, clean that body so that we reduce your risk for issues in the future. So I love looking at the genetic testing to kind of see where the SNPs are and what the risk factors are. People come in and they're very, everybody in my family had cancer, so they're just sort of resigned to the fact that that's their future. And I try to empower them in that no, but you can take action to prevent that as your future, because it really isn't the genetics, it's the environment, which goes back to the toxins and the food and all of the things that we're putting in our bodies. I think it's very important for people, and that's why I'm excited about getting this out to people. It's like people are they don't realize that how much they can have power over their health, that they really are in charge of whether they're going to be healthy as they get older and strong and vital until they're in their 80s and 90s, or they're going to be sick in their 50s and 60s. They have ownership over that. And I don't feel that in medicine did a good enough job empowering patients to believe that. You just come in, you spend your 5 minutes, you get your prescription, you get another prescription, and there's no talk about nutrition and stress and all the things that could be making you sick.
Absolutely. And it really is our system, because there's a lot of well meaning men and women that go into the healthcare field, whether they're physicians, whether they're mid level practitioners, whether they're assistants. I mean, at the end of the day, it's an honorable career field. I just think our system is broken. I do believe, I want to educate our listeners that we have one of the greatest healthcare systems in the world for trauma urgent care. You were a junkie when you got that bug with the EMS, or that cortisol. Just exciting to see there and helping these. We have a great system, but for chronic disease, I call this advanced chronic disease. We have one of the worst healthcare systems. According to the World Health Organization and according to CIA.gov of all places that does the research, the United States ranks like 49th in the world for longevity. Longevity, and we spend 2.7 to 2.8 trillion, that's with a T, dollars on healthcare. That's about 18, close to 19% of our gross national product. And we're ranked 49th in the world. We should be number one in longevity. We should be number one in wellness and prevention. And I'm excited right now on what's happening with this administration, because we're going to devote a lot of resources to re-educating the practitioners. Nutrition does make a difference. It's not a panacea. Nothing's a panacea. I think you got to look at all these different factors, as you mentioned as well, and take an intelligent approach. But ultimately, it's up to that patient. They are the CEOs of their body. I love the fact that you mentioned genetics. I'm all for genetic testing, but it's not the cure all. When they crack the genome back in like 30, 45 years ago, a lot of doctors, oh, this is great, we're going to solve all the health. Not at all. I mean, we have 23,000 DNA and billions of base pairs, right? It's how you wear those genes. I like what your analogy. Can you repeat that one more time about the gun and the trigger?
Genes load the gun, but the environment pulls the trigger.
I love that, because it is environment. Hey, this is Dr. Gez Agolli and Rethink My Health. We're talking to an expert right now, Dr. Kristine Blanche. She has devoted her life. She recently got appointed to the National Institutes of Health for Complementary Integrative Medicine as an advisor, and she's going to shake it up because she takes action. I know Kristine for many, many years, she's going to take action. We got about a minute before break, Kristine. Any other words of encouragement for our listeners on how to take responsibility? And then we're going to move on to some other topics because I want to really talk about breast cancer as well. We're seeing more and more younger individuals with breast cancer. But any last words of wisdom before our break that you want to tell our listeners?
I mean, I think just remind yourself that, every step you take, every piece of information that you learn, and then change a lifestyle or a behavior or something that you eat, every step you take is a step in the right direction. So don't feel overwhelmed. It can be very overwhelming. And we just need to keep moving forward and learning more and empowering ourselves and empowering our families to move towards health.
Great words of wisdom, Dr. Kristine Blanche. Hey, Dr. Gez Agolli here, Rethink My Health. We're going to take a short break and we're going to come back and we're going to tackle women's health care and we're going to talk about breast cancer, autoimmunity. Both of these diseases are on the rise right now. There is hope. There are some new technology. We're not telling you to abandon traditional healthcare. This is complementary, it's integrative, it's thinking outside the box. As a matter of fact, there is no box. This is Rethink My Health. Back in a moment. Let me ask you something. Have you ever felt like you've been doing everything right, seeing doctors, trying medication, changing your diet, but you're still not getting real answers? At Progressive Medical Center, that's exactly who our team sees every day. We work with people who are tired of being told their labs are normal, but they don't feel normal. Patients dealing with fatigue, brain fog, hormonal imbalances, weight struggles, or chronic conditions that are just not improving. Our approach is totally different. We don't just manage symptoms, we look deeper. Using advanced testing and a functional medicine approach, we help uncover why your body's out of balance and create a plan that's specifically tailored for you. Now, I'll be honest, this isn't a quick fix. Real healing takes time and it takes the right strategy. But if you're ready to finally understand what's going on with your health, we're here to help guide you. If this sounds like you, I invite you to take that first step. Visit us at progressivemedicalcenter.com and let's start getting you real answers. Welcome back. Rethink My Health. This is Dr. Gez Agolli, your host, integrative practitioner, doctor of natural and public health, working on root cause. And we're tackling on a very unique topic right now. Women drive healthcare. Women take initiative. They're in tune with their bodies. But we need to get more information out there. And I love talking with Dr. Kristine Blanche because she is an expert on women's health. I love the fact that she's looking at tools that will help her patients be proactive. She's thinking outside the box. Thermography is a fantastic tool. You know, as Americans and as humans, we're very visual. We need to see something, especially New Yorkers, right? New Yorkers need to see something first before they take action. And I say that because Kristine's from New York. I'm originally from New Jersey, but that's a different topic altogether. And I've been in my entire life, I've been really searching for root causes and for really innovative diagnostics. And I think thermography plays that. I kind of want to shift gears a little bit right now. And we've talked about some of the approaches you take with women's healthcare. Cancer. Uh, cancer's on the rise, Kristine. And I want to talk a little bit about that because you're right now you're going to be an advisor, and unfortunately, cancer continues to rise. The NIH reported last year that well over 2.3 million Americans were diagnosed with cancer. Breast cancer is really up there, and it's very prevalent. I think 1 in 8 women are predicted to get breast cancer. Let's talk a little bit about what you've looked at um, from a screening perspective. What else do you do and encourage your patients to do? Is it self-examinations? Is it being more aware? What do you do as a practitioner?
Absolutely. I became very interested and focused on breast cancer because of my initial practices back 20 years ago were in Long Island, and breast cancer is known to be an issue in Long Island for a long, long time. And for me, looking at it from a root cause perspective, I did a lot of research. We didn't have AI back there to pull all these studies for us. We had to actually go and research and look for the studies. And every time I took care of a patient with breast cancer, I did even more research because my goal for that patient with breast cancer was to help figure out the why did they get cancer, right? And then complement their care, boosting their immune system, helping reduce sugars in their diet, helping them be on an anti-inflammatory diet while going through therapy like chemotherapy or radiation, and really helping boost their immune system so they handle the therapy better. But in the meantime, in the back of my mind, it was, okay, well, how am I going to learn from these patients to help prevent people in the future? Because that's what we want to do, is prevent these diseases in young women. And so doing the research and uncovering the link between toxins and breast cancer, we know parabens, there's studies showing that parabens are literally found in the breast tumor cells. Like, there's actual parabens in the tumor, right? I grew up putting aluminum under my arms in my deodorant my whole life, right? We know aluminum is a toxin, and it decreases the immune system, and it feeds cancer, right? So all of the things that we've been doing without knowing, we're increasing the body's burdens of chemicals, which increases our risk for all cancers across the board. But breast cancer, prostate cancer, these are very sensitive to toxins. We know that the toxins are definitely a culprit in the development of breast cancer and prostate cancer. And so, these are things that we have to look at. And if I take a woman and get her through her chemotherapy and help her to, get into remission from cancer, I then want to look at her daughters and her granddaughters and do the work early, get at their levels of vitamin D. Like, vitamin D is such a simple thing, right? And in a day and age when the last couple of years I'm hearing that the insurance companies don't want to pay for a vitamin D level, that to me is so disturbing. Because we know New England Journal of Medicine suggests we have to have our levels between 80 and 100 to prevent colon cancer, breast cancer, prostate cancer. Vitamin D is inexpensive, safe, and everybody should be taking it, right? So these are little things that we know can make such a profound difference at so many levels that are not being talked about in the oncologist's office. They're not being talked about. Patients don't know until they come to us, which I don't understand.
It's very unfortunate because you're 100% right. And vitamin D is actually a pro-hormone, and it's fat soluble, and it's something that should be routinely checked at least once a year. And for those that have a deficiency, especially if you have a darker melanin and you're not getting the absorption. And I like the Vitamin D Council. They've got some fantastic research. They actually even have charts on what time to sit in the sun and what direction and how many minutes you should sit there, based on the melanin of your skin color. And that's really, really important. We've been taught at an early age, avoid the sun. Now, what I'm saying is use the sun responsibly, okay? And that just depends on the shade of the melanin of your skin. And the Vitamin D Council does a fantastic job. And you're right, between 80 and 100 is therapeutic levels. And certainly you can use, I recommend vitamin D3, of course. I know you do as well, not D2. And, now there's research obviously using vitamin K together, helping the absorption. Also has a lot of benefits for cardiovascular health as well. And now we're seeing women rise with cardiovascular disease as well too, in addition to the breast cancer. But I want to stay with the cancer just for a second. From a diagnostic perspective, let's talk a little bit about this then. So a patient is diagnosed with breast cancer. They're seeing their oncology team, which we recommend to find a good oncologist that you can get some advice for. Unfortunately, a lot of oncologists are not trained in nutrition. I hope that changes in the future because I'm hearing this time and time again from patients that their oncologist said diet doesn't matter. Eat what you want. We want to make sure that you gain weight. What's your opinion on that? And I know that one diet does not fit all, but how do you feel about when you hear patients say that?
Well, I'm optimistic that now there's a push to get nutrition into medical schools. I think we have to start there because you don't know until you know, right? So I don't believe that we have the education for nutrition in the medical field right now, and that's a disservice to our patients. I've had chemotherapy patients come in and be told, eat a ton of ice cream and burgers because we don't want you to lose weight. And that's their only focus. That's what they've been told. And then they come into me and I try to explain to them that, we know that cancer loves sugar and sugar can feed cancer, and we need to start to pull back from the sugar. We need to get you good sources of clean protein. We need to pull back from the chemicals in the processed foods, eat whole foods. And this is brand new information. And, and patients shouldn't be months into their chemotherapy treatment post-surgery when they're just finding out this information. It just, a lot of it makes sense, it seems like common sense to eat whole foods and not eat sugar, and that chips and Burger King is not going to be great to eat when you're fighting cancer seems like a common sense thing, but it really isn't. It is not a widespread understanding, even within the medical community. And I'm very optimistic that that's going to change.
I'm very optimistic as well, just by looking at the changes so far. that I'm seeing right now, and I think it's everything takes time. Okay, we have to move in the right direction. I think there's enough exposure right now, and one of the reasons why we got here, and I say this time and time again, that if our system worked right now for treating cancer, if it was the panacea. Why have we seen an increase from 1972, which 1 in 7 Americans, when President Nixon declared war on cancer in 1972 or 73, and he allocated hundreds of millions of dollars of research. Only 1 in 7 Americans. I use the word only. That's a lot back then. Now, 1 in 3 in women and 1 in 2 in men because of prostate cancer. Here's the reality. We have to start asking questions. We have to be more inquisitive and we have to start thinking outside the box. And I believe that nutrition is a pivotal point for the body to become resilient. Now, I'm not going to sit there and say just do nutrition because that's not wise. You've got to take an integrative approach, and that may require some chemo, and that may require possibly radiation, surgical intervention. A lot of individuals get upset saying, wait a minute, I thought you're natural and functional integrative. No, we're here to help you save your life, and you got to use the best tools out there. But besides diet, what have you seen out there for breast cancer that's exciting for you from an integrative perspective when a woman is dealing with breast cancer?
I think that prevention is really, really important. I think that using everything we've learned, I think the reason the cancer rates are going up is just we're just more toxic. There's more toxins. We're inundated with it, and the immune system is, seeing toxic in food and air and water, and we were not built to survive this type of environment, right? So we're breaking down, and I think that also stress levels play a big part. We know that when you're stressed, your immune system is run down. I get excited about taking care of the whole person. When somebody comes in with any kind of cancer, any kind of illness, first of all, really helping them understand the why is very empowering for the patient, right? Because all you ask when you get diagnosed is why me? Like that is what goes through your mind. And if you can really sit with a patient, get to know them, partner with them, educate them on all of the things that led to the why, right? So was there a ton of stress? Did you go through a very stressful year of your life 2 years ago and that really suppressed your immune system? How did you deal with that stressor? How toxic are you? How is your microbiome a mess and you're very toxic so you can't even handle it? Like, oh, it's so empowering for women to be like, oh wow, this broke down here. This. It was a perfect storm of things that happened to me over the last few years, like a lot of dominoes. And now this is where I'm at. They then know, okay, I'm going to get through this treatment, whatever it takes. I'm going to save my life, whether it's chemo, radiation, surgery, whatever we need to do to get that body to be cancer free. They are now empowered with an arsenal of information to know they're not going to let it happen again. And it's such a shift. I watch it in patient, and it's such a privilege to be part of that partnership with these patients because they're no longer sitting afraid like a victim, right? Because a lot of women come out of cancer treatment and they're terrified. And they never truly get back to their lives, their vital lives that they can. Cancer can be a pivotal point that changes an entire dynamic of an entire life. And that is a privilege to be part of with my patients because my patients come out on the other end. They're warriors. They're warriors for themselves. They're empowered with information. All of a sudden, their whole families, I have 3-generation families that come to me because they are not going to let that hurt their kids, their grandkids. And it's so what medicine should be. It's what going through a terrible dynamic. It's what I wish that I could have provided for my sister-in-law. But now I help other women do that. And, you have to be proactive with your health. Prostate cancer is such a good example of what, the conventional mindset. Now we've, pulled out the prostate exam. We're not even checking prostate exam as part of a physical. It's just sort of kind of accepted that if you live long enough and you have a prostate, you're probably going to get prostate cancer.
Exactly.
I just
Yeah.
completely reject that mentality. No,
Well,
do something
it's basically the wait and see until it's too late, which is really
Yes.
odd. Wait and see for what? Okay, until it happens and it manifests into a disease process. I love the fact that you are helping your patients resilient. So about a year and a half ago, we had a patient come through, Dr. Pete Sulak, and he was given a 1% chance to live, a brain tumor. And Dr. Pete talks a little bit about that. He had two aunts that had cancer, and one of them just did straight traditional, and one of them did like functional integrative, and they both survived. And the reason why was the fact that they became resilient they became warriors, and they had the mindset that they're going to beat it. So that to me is probably the most important thing. And I love the fact that you take the time, and basically you're coaching. You're a practitioner. You're a doctor. You're leading people. You're coaching people, and I think that's a shift right now in medicine because we need more coaches. We need more inspiration, inspiring patients to take action. There's no such thing as a panacea. Chemotherapy and radiation are not going to cure your cancer. Okay. Now, they may help facilitate it. You have to use wisdom. There's a time to use the big guns, and there's a time to step back and to regenerate the body. But you mentioned something very powerful that I heard, stress. And I think there's a confusion there, Dr. Christine, on stress. A lot of patients think, oh, stress causes disease. No, no, no. Stress could exacerbate. Stress lowers your immune function that may allow that disease to manifest. And I do believe that we need to do a better job in our country when it's how do we deal. You're not going to avoid stress, okay? You can't live in a bubble. You can't put your head in the sand. Actually, believe it or not, some stress may be good to take action. It's how you deal with it. I want to focus a little bit about cortisol for a second because I know at Progressive Medical, we do focus on cortisol. What's your opinion on measuring cortisol, and how do you work with a patient with managing that when you see cortisol off the charts?
Yeah, so I came up in New York in my integrative career, and practicing in New York is a little bit like practicing with handcuffs in that there's a lot of testing that you are not allowed to do. So I relied tremendously on my interviews with patients, the history, right? So I would listen to their history. I would talk about their stress levels. What are they doing to manage the stress? How is their sleep, right? We can tell a lot from sleep. Are you waking up between 3 and 5 every single night looking at the clock? That tells me a lot about your cortisol, and that your cortisol is low. So I always tell people, listen, your adrenals are this big. They were not built to live like a New Yorker. And believe me, I practiced in one of the highest stressed environments in the country. We are born and bred to thrive on stress, and like, what? Stop and take care of myself? That's crazy. I don't have time for that. So I worked with patients that were incredibly resistant. I have a great story of a gentleman who worked on Wall Street, and he came in and he was stressed out every single day. And I said, you got to meditate. He laughed in my face. I'm like, listen, you got to take the train into the city anyway. Just put on the headphones, do your breathing. Your testosterone's 200. You're not going to, you're 30 something years old. That gets men's attention. I can get men to spin around and breathe and do yoga if I tell them their testosterone is low, right? And there's a big
Absolutely, that
connection.
motivates them.
Yes, the cortisol and the testosterone, that's my game changer. And he called me one day and he goes, oh my goodness, I was the market crash, and I was on the floor, and I did that breathing crap you told me to do, and I didn't get chest pain. And I was like, yes. Like, it's such an aha moment. But I always say, like, it's not the stress that kills you, it's your reaction to the stress. And we do have power over that. And believe me, I was the most type A, uptight, my kids will tell you, OCD mom when they were little before I learned all of this. And I had to learn to be who I am today. It didn't just happen overnight. But I do believe that stress is a major factor for most people in the origins of especially cancer, heart disease for sure. Stress has the power to really hurt us if we let it, but we have the power over that. And unfortunately, there's no magic wand or easy, quick pill for that. You have to actually do some hard work, but it really makes a big difference, and it helps enrich your life. I was a much happier mom after I started practicing yoga than I was before.
Absolutely, yes. And there's many ways for stress reduction. I think it's really important for our viewers and listeners to understand if you're dealing with cancer, and what's the best way to treat cancer? Prevention. So even before you have that diagnosis, right? All of these lifestyle changes we're talking about, whether it's yoga, meditation, prayer, certain exercise consistently, and really looking at this anti-inflammatory diet because all of us are uniquely designed, and food is powerful. Okay, your medicine is your food, and your food is your medicine, and the reality is that we need to take a step back and really evaluate, do a self check. And I think that's really, really important. Now, what's interesting, you mentioned about testing, is that our philosophy at Progressive Medical is that if you don't test, you just guess. And cortisol is a big, big part of that because what we've seen, Dr. Christine, is that the majority, not all, the majority of our cancer patients have adrenal dysfunction, either extremely hypoadrenal, where it's very a flat line, and that could be because of after the diagnosis and everything, or high cortisol levels at extreme levels, and the body is just on this constant fight or flight, and it's just really in a sympathetic mode instead of parasympathetic. Have you seen that as well, working with some of your clients?
Absolutely. And the fight or flight, I try to describe it to people as like, we're just a big battery, right? So if you have a million windows open and you're not recharging, you're not sleeping well overnight, your battery's going to run out sooner, right? So it affects the adrenals, the fight or flight. We can only handle so much. And the body thinks it's the bear in the woods. It's the bear in the woods. It's not the commute to the city. It's not the stressful job and the difficulties at home. It's you can only handle so much. It suppresses the immune system and it leaves you open to a lot of different things. And I think that the stress is a major factor, and patients just don't realize. And you can implement certain. This just goes back to that. Start somewhere. Just do 10 deep breaths in the morning. 10 deep breaths at night, 10 deep breaths before you eat your meals. Just start lowering the cortisol, giving your body that little shift of, I'm not dying, I'm not dying, I'm not dying, because it does. I think you're dying all day long, and it's very, very stressful. And it's, the adrenals are only this big. They can't handle it.
Well, in your career helping these cancer patients, because I know you're helping them from a complementary integrated perspective, how do toxic relationships that they were involved in affect their healing process?
Yeah, absolutely. I mean, that's again, that's the partnership with the patient and taking the history and really talking to them about what's going on. I certainly have seen trends in certain kinds of cancers, and a lot of authors have written about this as well. But, breast cancer, as that being an area of expertise for me, I can usually identify a relationship. Listen, we've been giving our breasts to give to our babies. That's why we have them. They have a purpose, right? So they are very giving. If you have a relationship, let's say with a husband or a sibling or a parent, you know, where you're giving to them in maybe an unhealthy way, we want to help you kind of heal that. We want to help you heal that relationship, bring awareness to the fact that that may be draining you, and that can be leading to a potential problem in the future. And I can say with certainty, I can identify that in most of my patients over the years. And that's a big part of our learning about the relationships and the effect it can have on you, and healing it so that you can have a healthy relationship moving forward, and some boundaries so that you're not just giving, 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 giving. You have healthy boundaries that, as a mother, if I don't take care of myself, we just start putting everybody else first. Our kids are first, our husbands are first, and we take care of ourselves last. That is a very unhealthy dynamic. And what I say to my patients is, if I don't take care of myself, I'm sick. Then how's that going to affect all of my family? What if my kids lose their mom? How have I helped them? So that's what I use to teach my patients. You have to put yourself first, and it's hard, and you have to learn it. Just like learning yoga or meditation or how to relax, you have to learn to put your health first, so that your children and your husband and your family's dynamics are going to be better because you're healthier. And it's a big part of the process of healing, I believe.
Well, unfortunately, it's almost at the point when someone has cancer, that's when they take action. And the advice you're giving is solid. And the reason why I say that is that, over the past 30 plus years, I've noticed patients walking into clinics that I've been involved in. I've had multiple clinics with Progressive Medical, and there's been some common denominators. And one of that is stress, can exacerbate that, as you mentioned, but also trauma and not dealing with these relations properly. And not all cancers, but a very high percentage. There's some trauma, whether it's 5 to 7 years previously. It's really interesting, by the way, whether it's a loss of a loved one, a divorce, loss of a job, something traumatic. Have you seen something similar like that?
Absolutely. Yeah. I mean, I can usually identify some major trauma in my patients with cancer in the 5 years prior. And a lot of times a relationship which is still present and causing draining them, causing issues. And I think, unfortunately, as a community, we've lost a lot of community. Like, we don't have a sense of community. And community is shown to foster health. And I think that's why you're seeing a lot of group therapy now and a lot of group wellness, because I think it's wonderful to see that community doing this together, and having community is so important. And I'd like to see us to get back to that
This
too.
is great advice, Kristine, and I really appreciate it. We're almost at the tail end of our show. Hey, this is Rethink My Health, Dr. Gez Agolli here. What an exciting show, dealing with an expert, Dr. Kristine Blanche, who now is going to be focusing on some public health issues. This is exciting, Kristine. I'm so proud of you. Congratulations on your appointment to this board. This is fantastic. We got a couple minutes left. I'm going to let you talk about your vision. Give me your vision for integrative complement medicine for the future. I know we got a couple minutes, but just tell me your vision and how to inspire our listeners.
Absolutely. I mean, listen, I'm excited about the message getting out to people throughout the country that we need to think about our food, that there are chemicals in our food that are not allowed in European countries. And now we're going to make things happen that is pulling these chemicals out of our food, and also bringing education on nutrition into medical schools, getting the information out to docs that we have to start thinking about this. Getting preventative things covered by insurance is a breakthrough move, because that has been a limiting factor for access for patients to be able to get this covered, to be able to see a function. I would love to see functional medicine, meaning the partnership of a doctor and a patient, and education being the primary tool, become conventional medicine. I would like to see that transition happen. And I think we're at a time where I never thought I'd live to see the day. I thought this would be many lifetimes in my children's future. But I think we have the potential to make that change and pull up the curtain and provide the information to not only the patients, but the doctors. Because I will tell you, having been a conventionally trained practitioner and now an integrative practitioner, so much more rewarding and fulfilling. And I think once you get past the shock of what you don't know, and then incorporate in all the new tools, it's what the art of medicine should actually be for everybody.
Thank you, Dr. Kristine Blanche. Words of wisdom. We're excited to have you on this council, and I really wish you all the best. I know you're going to make an impact because I know who you are, and I share your vision. I'm excited right now. We're going to make some positive change. Hey, this is Rethink My Health podcast. We come to you each week from our studios in Atlanta. We're excited to share information to empower you. And remember, an ounce of prevention is a pound of cure, and a cheerful heart is good medicine, but a crushed spirit dries the bones. Proverbs 17:22. God bless you guys. See you next week.